All right. Well, thanks so much for being here. I'm grateful that we've got Nurse Mary Tornabene here, who's been with the agency now, partnering with us for, gosh, it's been more than 20 years now.
I think so. Yes, it's a pleasure to be here. Thank you for asking me, Todd.
Yeah. And I'm Todd Stull. I'm the clinical director here at Journeys, and we thought this would be a great time to talk about COVID and talk about the different things that we've done to keep people safe and where we see things going over the next few months and how we can continue to keep people safe and get people vaccinated. So I guess the first question I have is, what do you think that we've done well at Journeys over the last 18 months or so under your guidance to keep people safe?
I think the biggest thing is that I think the agency itself, and as did Heartland Alliance Health, we really listened to our experts, our public health experts, and developed plans that were for participants that were in line with the best and latest guidance from the CDC and Human Resource Service Administration. We followed guidelines and we educated not only our coworkers, but the participants as well. Some of the things, such as your hotel program, was brilliant. The education that we did and the guidance that we gave participants when they were in the hotel programs on social distancing and masking, and the volunteers that you had that made masks so that people constantly had new and clean masks, really worked positively to keep people healthy.
That's awesome. I'm glad that we have been able to partner for so long, but especially during the pandemic. I can say that the agency would not have known as quickly or as well as what to do if it hadn't been for your guidance and Heartland coming in and helping. I guess talk a little bit more about the importance of masking and how people should wear their mask and that kind of thing.
So people should wear their mask tight across their nose and flush on the sides. I have a mask here. It goes like this, pinch there, so you get a good seal. You want it flush on the sides. You want to make sure it's not pouching out. You're going to wash your hands before you put your mask on. You're going to wash your hands before you take your mask off. And that is the safest way to wear a mask. Wear it when you're inside at all times, when you're around other people. Outside, if you're in a very large crowd, I still wear mine, but that is not the current guidelines, but it is what makes me feel comfortable.
So I've been
mask every day or wash it after a day.
Oh yeah. I mean, that's
participants
seems pretty critical. Yeah. So I've been hearing some people say that once they're vaccinated, that there's no need to wear masks in certain places, or that they'll be perfectly fine. What's the guidance on masking once you've been vaccinated? Is there anything that people should know about that?
Well, with the Delta variant and the data, especially the data that has come out of Israel lately, there may be some waning immunity after 8 months with the vaccine, but it also could be related to the Delta variant. So masking in an indoor space, fully vaccinated or not, needs to happen. The thing about being fully vaccinated, and then, the vaccines were developed to prevent severe disease and death, and that was the initial endpoint, and they're very effective with that. They were not actually developed initially to prevent COVID infection. Mm-hmm. People can still get COVID and asymptomatically spread it, especially the vaccinated can really spread it to people who aren't vaccinated. This is an epidemic of people at this time of people who are not vaccinated. That is what's filling up our nation's hospitals and intensive care units.
Yeah, that's very unfortunate. And correct me if I'm wrong, but I think we've had just a very small number of our clients test positive for COVID, but I don't think there's been any particularly bad outcomes with any of our clients.
There have not been any bad outcomes with any of your clients. We did surveillance testing, we did mass testing of everyone. Very few cases were identified and no hospitalizations related to COVID or deaths.
That's been amazing. What do you think contributed to the low number of cases up to this point?
The hotel program. Journeys has worked so hard to develop trusting relationships with participants over the years, not just at this time, but the work that you've done as long as I've been here to engage people, I think, is really the cornerstone of your success. And they listened and they trusted. And so when they were told by us to stay in their rooms and to socially isolate, social distance, wear their masks, they did.
Yeah.
And they followed what we should all be following.